The patient is late to the appointment and reported that her dialysis port is a little leaky. I noted dry blood and fresh blood as well. The patient has hepatitis C, a blood-borne pathogen, so my plan will start with identifying the proper PPE. In this case, I will select a standard precaution, which involves hand washing and gloves. Prior to her entering the office, I will have already cleaned the table with the proper cleaning solution and applied fresh linens to be used. I will have washed my hands for 20 seconds and utilized some more water and appropriate soap. I will have greeted my patient and checked in with her, at which point when the therapy would start, I will then instruct her to don a gown on and situate herself underneath the sheet. I will leave the room to allow her to perform this and return when she is ready. Upon my re-entry, I'm going to wash my hands again, 20 seconds, warm water, appropriate soap, and then I will be donning my protective, my PPE. I will consider a mask and a face shield and a gown. We would consider these PPE if I was worried about splashing of bodily fluids. The patient's port is not splashing blood, and they are not coughing. However, the presence of the blood on the port itself has increased the risk of contact contamination. So I've determined that the best course of action would be to continue with gloves and a gown. First, I'll be donning the gown, going through the sleeves first, locating the drawstrings, securing at the neck, and then at the waist. Next, I'll be donning the gloves. Taking care and minding that the glove is over the wrist of the gown. At this point moving forward, I'm going to be limiting my contact with any surfaces to decrease the risk of any type of infection. Next, I'll be addressing the positioning of the patient for a left iliopsoas treatment. The patient will be in supine for a short-term duration. I'll be taking care to create a normal spinal curves and to support extremities as needed. At first, I'm going to support the head with the pillow, and then I'll be placing a bolster underneath the knees. At which point, I will be checking in with the patient. How are you feeling?
Great.
Great? Okay. If her back hurt, I have a towel ready, a folded towel to put underneath her lumbar. Or if her ankles were hurting as well, I'd have some rolled up towels for those as well. I'm trying to ensure that she is comfortable throughout the duration of the session, and I'll be checking in with her periodically to make sure that's it. Next, I'll be addressing the draping. Her long-term peritoneal dialysis port is located on the right side of her abdomen. We will be working on the left iliopsoas. So her gown and the linen sheet should be enough to prevent any infection. I will be utilizing another sheet across her lap, another one across her lower rib area. Okay, I will be pinning and pulling the sheet from this area right here to limit the exposure. Tucking in the sheet right here, and making sure that she is still decent. Okay. Finding your Quiroz. Once the treatment is done, I will remove the draping securely and safely as to not expose my patient. If there was any contact with any blood, I would dispose of this in the infectious waste. Next, I will doff all my protective equipment, starting with the gloves, pinching at the palm. Make sure to turn inside out, wonderful. Then for the second hand, underneath the wrist of the glove, making sure that it all stays inside the glove. Again, any contact with any blood, infectious waste. Lastly, the gown. The neck, being sure to not touch the front of the gown and to not allow my sleeves to touch any of the body. Now we'll come from the top here. turn inside out. Again, any blood, any infectious waste. I will then communicate with my patient, see if she has any other questions. We'll allow her I'll leave the room and allow her to get dressed. I will have washed my hands prior to that again. And then check in with her, have a conversation with her afterwards, and address anything that needs to be addressed.